The first of the back taping techniques is that for SIJ stability. The SIJ joint sits just above the bottom and just below the lower back. This taping technique provides stability through the SIJ joint, just through there. I always like to use a hypoallergenic underlay to make sure we protect the skin as there's some folding and puckering of the skin during this technique. The most important part for this technique is that you go from the side of instability to the side of stability. So for the patient here, left-sided instability, the tape will be running from the left to the right. Provide a nice firm strip. As you can see, the skin will fold to the other side. Again, I like to use 2 to 3 strips. As you can see, most of the folding is applied to the left-hand side. And that's your SIJ taping done.